And so once again, we thank you for joining us for our monthly presentation on FASD. This month, we are thrilled to be joined by Ken Inbar of the Lanark Children and Youth Advocacy Center, which is associated with Open Doors Children's Mental Health. But before we begin, we have a special guest with us today who would like to bring greetings. We're thrilled to have MPP Natalia Kusendova from Mississauga Center join us today. And we just turn the mic over to you at this point.
Well, good morning, everyone. And I'm so thrilled to be here today on behalf of the Government of Ontario, but also as a registered nurse and someone who has great interest in all social determinants of health, including the one that we will be discussing today. And I just want to commend the Lanark Children and Youth Advocacy Center for the incredible work that they do in helping and protecting the most vulnerable members of our community and our society, namely our children. You know, as a nurse working in the front lines, I have seen some devastating impacts that some social determinants of health can have on our children's health, growth, and development. And of course, today we'll be discussing fetal alcohol syndrome, which is a brain injury that can occur when an unborn baby is exposed to alcohol. It is a lifelong disorder with effects that include physical, mental, behavioral, and learning disabilities. And these can vary from mild to severe. So an early diagnosis followed by appropriate interventions and supports helps to minimize the disabilities associated with FASD. But of course, for me as a nurse, the most important thing is prevention. And how do we ensure prevention? Well, it's by educating young mothers and all mothers about the devastating effects of fetal alcohol syndrome. So that's why I'm so proud that our government is supporting and has made investments to the tune of $2.8 million and $4 million annually to support 12 new FASD clinics and increase capacity in 9 existing clinics, bringing the total number of FASD clinics across the province to 21. For children and youth impacted by FASD, receiving early access to diagnosis assessments supports early intervention will ensure children will have access to the supports and services that meet their needs. So I really look forward to the presentation today, and I look forward to engaging with your group and perhaps even with the new minister who is responsible for children and youth, which was just appointed yesterday, my good colleague from Burlington, Jane McKenna, because these issues impact us all. And you know, the more we can invest in the health and well-being of children, the better we will be off as a society. So thank you for having me today.
Wonderful. Thank you very much, MPP Kusendova, for bringing those words on behalf of the province. We certainly know within our group that you have been such an amazing advocate and voice that we certainly remember the conversations that we've had every time that we've came to Queen's Park, the interests and the passion that you have on behalf of people with FASD. We certainly also know that as the former chair of the Standing Committee of Social Policy and a current member on it, we watch with great interest that Bill 172, and we know that you are a really strong advocate on behalf of that as well. So thank you for being with us here today.
My pleasure. Thank you.
So at this point, we will go ahead and begin the presentation from Mr. Inbar. As stated before, the Lanark Children and Youth Advocacy Center is a fairly new concept, and it's designed to essentially make sure that children and adults who are victims or witnesses of crime do not have to be interviewed multiple times about the incident. And so this model is based on the model that originally came out of Toronto and has been adapted to a rural setting. It actually and Ken's going to talk about this, it actually originated outside of Canada in the beginning. But as you have questions, I would certainly encourage you to reach out to him. His contact information will be contained at the end.
Uh, Hello, my name is Ken Inbar, and I'm the team leader for the Lanark Child and Youth Advocacy Center. And it's my privilege to be chatting with you today to talk about the Lanark Child and Youth Advocacy Center. And I want to thank the Rural FASD Network for giving me this opportunity. So, what is a CYAC? Well, a CYAC is a multidisciplinary collaborative approach to working with children and youth who are victims of or witnesses to sexual or physical abuse. So what does that mean? It's really providing a one-stop shopping, so to speak, for these kids and their families. Because traditionally, the way an investigation would work for a child who'd been abused sexually or physically, the police may be called, the child protection may be called, and the victim or the witness may go off to a police station or a CAS office, or might be interviewed in their home. And then often they have to tell their story multiple times. And then after the interview, they may be referred to some services. But other times the victim, the witness, or the family have to go out and find the services. This approach brings everybody together in a multidisciplinary team. So CYCs have been around for just about 40 years. The first one started out in Huntsville, Alabama. They've been in Canada now for close to 20 years, and they exist all over the world right now. Around the world, there's something like 20 countries that have CYACs. In the US, they have 900, and in Canada, we're up to about 30 now. And specifically in Ontario, there are 9 that are operational, including the Lanark CYAC, and there are about 3 that are in development phase. So CYACs are considered a leading practice in the work around helping children and youth who have been victim of witnesses to some form of abuse. It's where police and child protection workers come together and working on the investigation. And rather than going to the police station or the CAS office, they come to a neutral location that's more comfortable, the confidential space. It's also a child-friendly space. One of the aims of a CYAC is to reduce the number of times and places that the story of the victim or the witness is told. All the investigators who do the interviews would be specially trained in how to interview children and youth. And the multidisciplinary team that's formed, which I'll talk a little bit about later on, they work together to try to ensure that the children and youth receive the services and supports they need. There are different models out there that exist around for CYCs. Some are known as standalones. That is to say, they are their own organization. They have their own board of directors. They are their own agency. Other CYCs follow an affiliated model. They're the CYCs that are connected to an existing agency. And the Lanark CYAC is an affiliated model. And again, I'll talk about that in a bit. Some CYACs are co-located, which means all the service providers, police service, child protection, the advocate, mental health service, even some health services are located on one site. Other models have CYCs being where there is a site and all the community partners involved come to the site when there's a case, or there may be some of the partners who have offices in the space. It all really kind of depends. Because all CYCs are a little different. They're all designed to meet the needs and the capabilities of their respective communities. So a larger urban area, for instance, may have a police service that has a designated sex crime unit, and they'd have detectives that's what they specialize in and have training and specialization with working with children. And then in smaller settings, there may not be the specialized units, and so so every CYC has to work with the services that are available in their community and design their model to meet those needs. one of the important pillars of a CYC is that the approach is a trauma-informed perspective, so that the victims, the witnesses, and the families are viewed through a lens that the trauma has occurred, and we want to ensure that the victims and the witnesses have a lot of choice in what goes on and a lot of control over things that they have control over. Another important pillar of a CYC is the advocate. And what is the advocate? They are a consistent point of contact. They are the go-to, as I mentioned earlier, in the more traditional way of doing the work. The client may have to go looking for services. The advocate, one of their jobs is to help the client understand the different services that are out there and help them navigate the different systems and help them hook up with those services and travel with them through the journey as they're seeking out services. So they are the go-to person for the client. And then they're also the go-to person for some of the other members of the multidisciplinary team. Again, one of the really important things is to give clients choice. So the clients get to decide who is on their multidisciplinary team. Certainly, there are some mandated services that are in there that have to do their job. So child protection that has a mandate. Police have a certain role, but then they have all the other players that might be involved in a case, and the client gets to decide who forms their multidisciplinary team. They can also decide not to have a multidisciplinary team. Again, it is their choice. So they give consent for all these people to work together and to be able to share information that's allowed to be shared with each other, all for the purposes of being able to help the client. Let's talk a little more specifically about the Lanark CYC. So a little bit of history. Like most things, it started with an idea. So a few years back, I was having a conversation with my executive director at Open Doors. So I work for Open Doors for Lanark Children and Youth. And he had asked me if I had ever heard of CYCs. And I said, well, I actually had, because I had attended a conference a few years prior to that conversation. And there was a presentation on CYCs. And at the time, I thought they were a very interesting concept. So I was then tasked to do some research and reach out to existing CYCs to learn more about them, and brought that information back. And then we decided to bring it to our board of directors to see if we'd have the okay to do further work around a CYC, and we were given the okay. And the steering committee was formed, made up of key partners in the county. And that steering committee then led to us doing a needs and feasibility study, all for the purposes of putting in a grant application with the Federal Department of Justice, because they provide grants through their victim fund to develop and pilot CYCs. So this was all in just prior through 2017, and then in late 2017, we put in the grant application. And in the spring of 2018, Open Doors was awarded the grant, a 5-year grant, to develop and pilot a CYC in the county. So the CYC is governed and managed by Open Doors for Lanark Children and Youth, but it's not really just a service of Open Doors. It is a community service. So it's not a service that belongs to Open Doors. It belongs to the community partners that are involved. So it's very much a collaborative community response. So working together with Open Doors to develop the CYC are key partners, and these key partners are our steering committee. And they are the Lanark detachment of the Ontario Provincial Police, the Smith Falls Police Service, Family and Children Services of Lanark, Leeds and Grenville, the Lanark County Crown Attorney's Office, Victim Services Lanark County, Victim Witness Assistance Program of Lanark County, the Lanark County Interval House, the coordinator from the Lanark County Situation Table, the Perth and Smith Falls District Hospital, and specifically the Sexual Assault Domestic Violence Program, which not only operates out of the Perth and Smith Falls hospitals, but also provides services to the other two hospitals in the county, the Almonte Hospital and the Carleton Place Hospital. Also on our steering committee are representatives from the Upper Canada District School Board and the Catholic District School Board of Eastern Ontario. So our CYC created a vision, mission statements. And so our vision is that children and youth have a right to grow up free of violence in a safe and healthy and nurturing community. The Lanark Child and Youth Advocacy Center delivers a service that promotes strength, healing, and resiliency in children, youth, and their families who have been affected by serious crime, violence, or abuse, and is sensitive to their unique needs by providing a comprehensive, seamless service and support. Our mission, it brings multi-sectoral partners together in one place to give children, youth, and their families a safe, comforting, and family-friendly space in which to start their healing journey. Provides advocacy, intervention, access to support services. Believes in providing a client-centered, trauma-informed system of support in which victims only have to tell their story once, and is dedicated to efforts to prevent child abuse and violence through education, awareness, and change. So I'm going to talk a little bit about the actual service. So we have a site, and it's been made to be child and youth and family friendly. And at this site, there's coordination and collaboration between the agencies for the benefit of the children, the youth and their families, but also the community and the broader systems. So we don't have a site where all the partners are co-located. It's a site where when there is a case, when there are meetings, people come to the site. So the service creates a continuum that starts with the police investigation or the child protection investigation. Often they work together, but sometimes there isn't a child protection concern, so they just solely police. And sometimes it may not be a police matter, and so it is just child protection. But it starts with the investigation, and there's victim support and advocacy, and then referral to medical and mental health, as well as other services, and also follow-up care. At the site, forensic interviews are recorded. Child's reduced a number of times. Stories have to be told. Hopefully, by doing all this, there's less trauma and less re-victimization. So the services of the CYC are totally voluntary. So the investigating investigators, the police or the CAS, offer the service to the client. They can opt not to make use of the service. And the service is at cost to the client or their caregiver. The ultimate hope is by creating this enhanced and coordinated model, there'll be the long-term dependence on such services, mental health and other community services may be reduced. Okay, so I'm going to kind of walk you through how a case comes through this CYC. So it all begins with the initial phone call. So someone calls either the police or Family Children Services, and then they determine if the case goes to the CYAC. And as I mentioned before, they often work together, but sometimes it's just a police matter, and sometimes it's just a child protection matter. The types of cases that are seen at the CYC, so our mandate is 0 to 18 years of age. The individuals have to be victims or witnesses of either physical or sexual abuse, or really any serious crime. But also when it's determined that the CYC would be the best place for an interview to take place, because by using the CYC service, it may help reduce trauma for the victim or the witness. So an example would be a child or youth who may have been a victim to a traumatic event, such as a serious car accident or a fire. So it's not necessarily a police matter, child protection matter, but it's still an event that might be trauma-inducing. So the client is offered the service, and the police and or family and children services and book an appointment at the CYC. And then victim services are also notified because they play a really important role. They provide the services of the advocate. So at the site, everybody arrives at the site, and when the family arrives, the advocate greets the family and attends to their comfort. We're looking here at a picture of our waiting room. Due to COVID, we had to change things up. So we are operational during the pandemic, but we had to put certain things in place for safety issues, just like many other places have had to make some modifications. So right now, our interview room doesn't have this lovely furniture. It has some chairs that are easily wiped down. Hopefully, once the pandemic is over, we'll be able to bring back the nicer interview room. Not interview room, sorry, the waiting room. But pre-pandemic, the advocate would then also offer the family snacks and refreshments. So this is our snack and refreshment station where juice and water are offered, and snacks and coffee, tea, and hot chocolate. But again, for safety reasons, we had to discontinue the offering of refreshments. But what still happens, though, is the advocate explains to the family in more detail what the CYC is, and they'll give a tour of the site if the family would like to get a tour. The advocate also takes care of all consents for service and consent to exchange information. This is really important because in order for members of the multidisciplinary team to work together, the client and the family has to give consent, and for the team members to have conversations when the client isn't present, they need to have that permission. Again, clients can opt not to provide the consent to exchange information. Again, it's completely up to them. And then also they get to decide on that multidisciplinary team. That's just another shot of our waiting room. This is our play area, which again, we've had to dismantle, but hopefully we will be bringing back real soon. Again, we want victims and witnesses and their families when they come to the site to feel comfortable. So after all the paperwork is taken care of and the investigative team arrives, the advocate introduces the investigative team, and all roles are explained, and the interview process is explained how things will kind of play out. So the investigative team, which is comprised of a member of the police services, sometimes it's police and family children services, sometimes either or. They bring the interviewees into the forensic interview room. Often it's just one interviewer in the room with a person at a time. Our forensic interview room has 3 cameras mounted on the walls and one up on the ceiling, and as well as 2 very sensitive microphones, which is really great because for anybody who's ever worked with children, and especially worked with children who might be nervous or anxious, they sometimes will lower their head and talk very, very, very softly, and which is understandable given the situation. Our microphones are so sensitive that a child can be bent down over the coffee table and be whispering, and the microphones can still pick up what they're talking about. So one interviewer is in the interview room, and the other investigator will be here in the monitoring room. And so the 3 cameras and the 2 microphones are send the images and the sound to a digital video recorder, and the other investigator sits here in this room watching the live interview, and at the same time records it. This is just a shot of another interview room we have at the site. This one is not a forensic interview room. It's just another space where folks can congregate and have conversations. Also, in pre-pandemic, it was opened up as part of it, the waiting room, so clients could spread out, which is also tied to the whole mindset associated with trauma-informed practice, giving folks choice. They don't have to just sit in the waiting room. They can sit also in this space here. So after the interviews are concluded, the multidisciplinary team meets in this to consult about the next steps. So anything that can be shared. Often there's information that can't be shared because it might jeopardize an investigation. And so information that can be shared is shared and discussed, and it helps provide the advocate with information to help figure out what might be some appropriate supports for the client. A very important and integral part of the multidisciplinary team is the child, youth, and the family. They are part of the team. So these conversations don't happen in isolation. These conversations about what all kind of planning steps occur with the family. So this is a picture of our multidisciplinary team office and meeting room. I apologize for the quality of the picture. The lighting wasn't all that good. So part of the purpose of this office too is when the community partners come to the site, they're provided with some workspace as well, so they can work out of this office as well. So it's kind of replicating what the co-located models of CYCs have, where people work from that site all the time, but where the investigators and the advocate or any partner involved can do a bit of work. So after the interview, if charges are being laid and the matter is going to be going to court, police will make a referral to the Victim Witness Assistance Program. They provide the court support to the victim and the witnesses. All right, so after the interviews are done and the multidisciplinary team meets, part of that process, if police will be laying charges and the matter is going to court, police will make a referral to the Victim Witness Assistance Program. They're the folks that provide the court support to victim and witnesses. They then form an integral part of the multidisciplinary team as the case gets closer to going to court. But also at the time of that first interview, during that consultation of the multidisciplinary team, there's determination by the team if there are any other services that the child, the youth, or the family require, and it's the job of the advocate to make those referrals. But also the advocate will have regular check-ins with the victim or witness and family on an ongoing basis. Usually the first check-in tends to be about a week after the interview to see how they're doing, if there are if there's anything that they need in terms of services that may not have been brought up in that first meeting. And the advocate continues to meet with the family on an ongoing basis. So we also have another service tied to CYC, and that's our mobile response. So Lanark County, as many of you are aware, geographically quite large, and has a number of communities. But unfortunately, we only have one CYC site. There are some folks who are comfortable in their community and they don't really like leaving their community if they don't have to. And there's some folks that also have some transportation issues, so getting to the site could be a barrier. So we decided last fall to pilot a mobile response. which I also call CYAC in a box. And what that means is we bring the service to the community. So we piloted out of the Smith Falls Police Station for now. They have a forensic interview room as well. And it geographically, it helps provide service to that part of the county. Hopefully in time, we'll find other locations that are more neutral throughout the county where interviews can take place. And what the plan is that the advocate will arrive at this neutral site, the big tote, and in the tote there's a portable video camera and microphone, all the forms that people need to fill out. There's also a tablet, because we're not in time put all our forms on a tablet for the client's convenience. And after the pandemic, we'll also have a selection of toys that will go with the advocate, again, to replicate as much as possible the experience of coming to the CYAC site. And it'll also be a service that will open up the opportunity for more people to access the service, because the barrier of distance and transportation will have been eliminated. Okay, so after the interview, we move into kind of the next phase of what happens at the CYAC. And that's what we'll call the multidisciplinary team case review meetings. And so it's just another shot of our multidisciplinary team office, and it's the table that we'd all kind of meet around. So usually within a week or so of the initial interview, the client is invited to take part in a multidisciplinary team meeting. They can opt not to have these reviews. They can also opt not to attend. We can still have the reviews, but they opt not to be present, and they delegate the advocate to speak on their behalf. And what happens at these meetings, all the relevant collaterals are invited. So the police, child protection, again, any other services that might be involved that form part of the multidisciplinary team are invited to this meeting. And at this meeting, a formal structured meeting takes place where information is gathered. There are updates, updates that can be provided. Certainly some stuff cannot always be provided. There is exploration around what are the needs of the victim and witness and the family. And then from that meeting, there are recommendations for next steps, and referrals to other services, if needed, are then made from this meeting. And then all plans are made, and they're evaluated. At this meeting, there's also exploration around if there are any gaps in the service delivery and other ways to fill those gaps. It's all collaborative, so decision making is a shared process. It's also an opportunity for the team members to discuss general issues related to the case, and also discuss how the team is functioning. Are there things that are working? There's things that need to be tweaked. And then from that meeting, at the end of that meeting, a service coordination plan is created, and it's created for the purposes of case planning. So on this plan, recommendations or goals that were discussed in the meeting are then turned into an action plan, and all the roles and responsibilities of team members are outlined on the plan, and then timelines for the actionable items are identified. And then at subsequent meetings, the plan gets reviewed, and if necessary, they get modified. So cases at the CYAC stay open as long as the child, youth, or family want to be involved with the CYAC. Some folks are involved just for a very short period of time. Other folks want the CYAC involved throughout the whole process going through court, and then sometimes even beyond. Now, not all cases end up going to court. Sometimes cases, charges are not laid, but the service is still offered and provided so that the clients still get the support that they require. Another thing that the CYC does is it arranges for trainings for the partners. So the CYC has hosted trainings for police and family protection workers around forensic interviewing of children and youth. They partnered with other community agencies to bring training to the county in trauma-informed practices. And we also, in the last year, been providing training tied to FASD. So partners were offered the opportunity to take courses provided through CAN FASD. But we also had this really exciting project that we partnered with the Rural FASD Network, and specifically Rob Moore, who put together for us a training module and a tool for the Lanark CYC, which gives really useful information on how to work with clients who may have FASD, and it's also it's an online tool that a community partner, when they're attending, so a police officer attending to a scene, or a CS worker starting their investigation, they can just go to this online tool and at their fingertips have some answers accessible to them on what to do to make the experience a better experience for this client group. So that is the Lanark Child and Youth Advocacy Center. I hope you found this presentation informative. We've been around now for a couple of years, and if you have any questions, this is my contact information, and I'll be happy to try to answer any questions anybody has. Thank you.
And so we thank Ken for taking that opportunity to put that this presentation together on our behalf. A couple of the key points that I would like to share with our audience out there, though. The first one that he did also communicate to me is the Department of Justice, that they got their funding from 3 years ago, and it is for a 5-year cycle, is they are absolutely blown away by the information and the research that's coming back as a result of these projects, and are looking to expand upon them. So definitely a funding partner that if you are interested in establishing an advocacy center within your local area, that they would be someone that Ken can definitely put you in contact with and start to have some conversations around. The other one that we also wanted to share, and Ken was mentioning about the FASD Training App that we have been pleased to be able to provide. They are our pilot funding partner as well. And so essentially what it is it's an app that you can install on your phone. And within that app, you can see fact sheets, you can see general information. It gives very specific information around how to interview someone with FASD. There's lots of training videos that are associated with it as well. And it is something that is easily adaptable to any organization that would be interested in receiving a copy of our FASD training app as well. So once again, we thank Ken for joining us here on our podium series, and we will see you all next month.